Hey, this is Jeff McCalca here at the Digital Health Summit Live studio here on the floor at CES. I'm here with Aaron Black from Innova.
That's correct.
Translational medicine. Aaron, welcome. Thanks for coming. And tell us a little about what you're doing and how you're involved with the summit.
So we just spoke at the Digital Health Conference. We spoke about a lot of the work we're doing in genomics, particularly with newborn health. Data is everywhere. We look at the conference here, so we're just showing how we apply that data to actual clinical care.
Great. So tell me, just give me to the next level down. What sort of data are you capturing? At what point? You said it was around infants and children. When are you gathering that, and how's it actually extracted?
So we consent a lot of our patients right at birth. So we sequence whole genome sequence infants. So when they come in, we consent them, we sequence them, and then we also do their parents. So it's like a trio.
Right.
So we do that. We extract the data. We make it into DNA at our in-house lab. We ship it off to a whole genome sequence vendor. They ship it back to us. We get it in the cloud, and then we start to bring that down to our on-premise to do the actual analysis.
And what sort of things are you getting out of the analysis at this point? What sort of ahas are we finding out?
So it's two different things. There's like a micro level. So we do sequencing for babies who are having rare disease. So we can't diagnose them, so we try to see if we can find something in their genome. So we can do that as part of our protocol. On the other side of that is the macro level, which is where we're doing more population health, genome-wide association studies where we're tracking about 5,000 families and doing the babies at birth, and they're going to track them over 18 years and see them come into the health system, see them break their legs and what happens to them, so we can start to stratify and understand more about how their genetics are affecting who they become as they grow older.
So whenever anyone talks about big data or even getting down to the genetic level and the coding and the sequencing, there are always concerns about privacy. And so what are your feelings about that? What are you guys doing as an organization to keep people's information secure?
It's very important to us. And it's one of the things that as we want to move quickly, we always have to think about that security. So in Amazon, we work with Amazon like hand in hand to make sure that we're compliant with HIPAA, with regulations on PHI, to make sure that our data is secure. And then we have data in the healthcare system, which we obscure. We actually never push that to the cloud. We keep it local, and then when we bring the data off the cloud into this middle area where we can analyze it, it's all very much protected by the health system's firewalls.
I find this fascinating. I think this is really where the future is going. Not only just the gathering of the information, but the analyses that can be done, as you said, at the micro and the population health level.
Yes.
Unfortunately, we're out of time. So if people want to learn more, where can they find you? What can they learn more about Innova?
Innova.org.
Okay.
You can go there. Part of that, within there, you'll see the Institute for Translational Medicine. You go to our webpage, you'll see our studies. If you're in the DC area, you can be one of our patients or participants in our research. And that's where I would start.
Okay, great. Well, so again, my name is Jeff McCalca. I'm here at the Digital Health Summit Live studio here on the floor at CES. I'd like to thank Aaron Black for taking some time to chat with us. And again, follow up with him directly online if you have any more questions.
Thank you very
Thanks
much.
so much, Aaron.
Appreciate it.